Currently, the International Myeloma Working Group recommendation to initiate a therapy upfront is for patients with CRAB criteria or with slim CRAB criteria, so the new biomarkers of malignancy, so what are called nowadays myeloma-defining events. There is a very, very big discussion ongoing that in the future this may be enlarged, this group of patients, also including very high risk smoldering multiple myeloma patients, so those patients that have a risk of progression in 2 years of 70% or more, but this is not nowadays the case. So the patient that we have to start treatment are those patients, and I can add maybe patients with a very rapid biochemical progression, maybe also in the lack of this strict criteria. The scenario, of course, up front for patients is changing. So I spoke about a newly diagnosed non-transplant eligible patient. Nowadays, the standard of care is the backbone plus a monoclonal antibody, but also a newly diagnosed transplant eligible patient. The anti-CD38 monoclonal antibody Daratumumab was tested in combination with VTD and resulted in better outcomes, both in the depth of response and progression-free survival. So the standard of care is changing, translating from a triplet to a quadruplet combination. Of course, BTD is not the best backbone that we can have. So currently other studies ongoing are testing the combination of Dara plus either VRD, Bortezomib Lendex, or KRD, Carfilzomib Lendex. So I think that the quadruplet combination of a monoclonal antibody plus a triplet of a PI and a IMiD will be the standard of care. Currently, as I said, in Europe, we have this VTD-DARA combination approved that we can use. In the future, probably we will shift on a better backbone as compared to VTD. So for sure, quadruplet for induction and consolidation prior and after autologous stem cell transplantation are probably one of the best options. And this is something that has changed in the very recent year. So all these newer combinations open again the question of transplant, yes, not upfront. So this is something that will come in the next years.